Hi ma'am, I am Ramya from Amrita School of Arts and Science. How to prevent dandruff?
Dandruff is a normal phenomenon. That is usually your skin, the superficial layers of the skin will be shed off. But when it is associated with itching, hair loss and flaking of the skin, that is called as pathological dandruff. That is called as seborrheic dermatitis in medical terminology. And persons with dandruff usually can have dry scalp skin and oily or greasy scalp skin. Those with dry skin on the scalp, they can use oils, and those with greasy skin on the scalp should avoid oil application. And seborrheic dermatitis, it's actually an endogenous eczema. It is exacerbated during summer due to stress, due to application of so many oils or comedogenic substances, due to hair treatments, and in certain diseases there will be increased incidence of seborrheic dermatitis. In such cases, you have to evaluate the patient and do relevant blood investigations and then choose the treatment. Otherwise, to prevent dandruff, you have to use minimal oil in dry skin and avoid oil in oily skin. Then every day you have to wash the hair and keep the hair dry. And dandruff and seborrheic dermatitis are usually common in the adolescent age group, that too due to hormonal changes because of excessive oil secretion. And you have to avoid oil based food, then oily preparations. Can use shampoos, anti-dandruff shampoos, especially medicated shampoos are available which contain ketoconazole and zinc pyrithione, which will reduce the scaling. And because seborrheic dermatitis has a fungal etiology, shampoos containing antifungal agents will take care of the fungus, and that will reduce the scaling of the scalp and itching of the skin of the scalp.
So how often do we have to use that, doctor?
We advise thrice a week application, and you have to apply the shampoo and rinse it for 3 minutes and then wash the scalp hair.
Okay. Doctor, we have heard so many of them saying by sharing the comb.
Because of fungal etiology, when you share combs and even towels, it can cause dandruff.
So doctor, is there a permanent cure for dandruff?
It is prone in eczema patients, and it has a genetic influence, and it is a type of endogenous eczema. It can have recurrence. So you have to take care of your scalp and hair daily to prevent recurrences. And it can exacerbate during CC. It has seasonal variations, and when there is stress, you can have increased exacerbation. So it is a disease with recurrence.